Hi, I'm Melody Tavakoli. I'm an optometrist out of San Diego, California. I'm doing a talk later today on contact lens complications. I wrote this lecture because I love contact lenses and I wanted to educate other doctors and para-optometrics about the complications that can happen, including microbial, inflammatory, mechanical, or allergic reactions to contact lenses. The most common challenge for patients with contact lenses is compliance. They don't always change the solution or change their case or overwear the contacts. So educating the patients and as doctors knowing what happens when patients do this is really helpful to be successful to prevent any vision loss. Instead of asking the patient, do you change your contact lenses monthly or bi-weekly or daily, I just make it open-ended. How often do you change your contacts, and how often do you change the case, which usually gives a blank stare of, I was supposed to change the case. And it's all about education, really. Not everyone gets all the education when they first get contact lenses. It's so overwhelming learning insertion and removal. So every year at that contact lens fitting, explaining the pros and cons to the contacts, how to take care of them, and really checking in with the patient, because we're basically saving them from themselves. I think dryness is probably the most common overlooked issue with contact lenses because everyone has dryness at this point and we kind of accept it for the patient, or they accept it. Another good question to ask patients is, what time of day would you want to take out your contacts, to get an idea of when they start bothering them, because there's a lot of new innovations in technology to help with dry eye in general and with contact lenses related to that. So the biggest challenge is discomfort, and I think people just put up with it. The best thing I can do for patients if they're in a reusable is to take them to a single-use contact lens, which usually increases comfort, increases compliance, and decreases any kind of discomfort or issues that people have with contact lenses. I think someone that's in reusable and gets tired of cleaning and taking care of the contacts, so anytime I have a patient that's in reusable, I ask them, are you tired of cleaning your contacts, changing the case, buying solution? And that usually opens up the conversation to, hey, if you only want to wear them once a week or once a month, daily use, single-use contact lenses is the way to go. And like I said, it does decrease a lot of the complications that happen with contact lenses. So part-time social wear is a great way to wear contact lenses. I do have a few slides at the end that helps the staff really ask questions when someone calls in and says, my eye's bothering me, to really facilitate, does that person need to come in right away today? Or is this something that can wait until there's an appointment slot available? So really fine-tuning the case history and figuring out what's going on, because most of these complications have the same symptoms of redness, irritation, light sensitivity, pain, discharge, but the severity, which eye, when did it start, all those fine-tuning questions can help get the patient in sooner if it is something really serious, or address it when it needs to be addressed.